Hello, good afternoon. My name is Rocio Flores. This is my gut brain research project on bipolar disorder for microbiology with Miss Jamie Adams. What is bipolar disorder? Bipolar disorder is a chronic mental illness that causes extreme shifts in mood, energy, and activity levels. Some of the symptoms that I listed here include depressive and manic episodes. Depressive episodes include extreme sadness, low energy, it could include suicidal thoughts and suicidal ideation. Manic episodes is the opposite. It's increased energy, and in this episode, we can see impulsivity and poor decision making, poor judgment. These symptoms can lead to problems that I listed here, like substance abuse, interpersonal relationships, and employment. Troubled relationships can be seen in a fact that I found that shows that bipolar individuals have a divorce rate that is 2 to 3 times higher than that of those individuals without a mental disorder. And some individuals struggle to keep friendships, and employment is often not continuous, and it's difficult for people with this disorder to maintain employment. Some of the treatments that we see here, the first one we have is the use of a combination of medication. We have antipsychotics and mood stabilizers. The treatment again varies depending on the individual and the severity of their illness. In order for a psychiatrist to evaluate the patient and find out what method might be better for them, they use a mood disorder questionnaire. The questions are aimed at identifying common signs and symptoms of bipolar that we see here on the left and finding ways to manage them. Bipolar is not curable, so we can only focus on managing the symptoms to help the patient be more functional. Like we said, there's a combination of medicine that can be used, antipsychotics and mood stabilizers. Atypical antipsychotics like common ones, Seroquel and Avelar, are used, and they block a combination of dopamine and serotonin receptors. Next, we see monotherapy. This is used in milder cases of bipolar. It's the use of only one mood stabilizer. Benzodiazepines, they're central nervous system depressants that work by slowing down that brain activity. And they are prescribed also with a mood stabilizer, but these are used for shorter term relief of acute symptoms because they can cause side effects like addiction, dependency, uncontrolled moods, and cognitive dysfunction. Next, we see interpersonal and cognitive behavioral therapy. Interpersonal therapy helps individuals improve their communication skills and their relationships. The patient is taught how to cope with their symptoms, deal with stressors like grief, maybe strained or troubled relationships, and how to recognize patterns of possible miscommunication and where the patient can improve. Cognitive behavioral therapy focuses on the patient setting goals to manage their symptoms. Things they can focus on is self-monitoring. This can help them recognize when maybe they're about to get into a depressive or maybe a manic episode. They can possibly recognize insomnia, irritability. Another common tactic that is taught in cognitive behavioral therapy is thought restructuring. It empowers the individual to control their thoughts and control maybe some distortions that may be going on about the situation in their head. Next. As I discussed, this is the mood questionnaire that psychiatrists can use to measure symptoms. We can read a couple of them here. We see, were you much more talkative or spoke faster than usual? That's usually seen during mania. Mania, when we see that high level of energy and just constant energy level activity, that can increase how fast the person talks and their overall energy mood. So this helps them find out what treatment is best, maybe that monotherapy if it's not so severe, or the use of both an atypical antipsychotic and a mood stabilizer. So now we are going to go over the differences in gut microbiota in individuals with bipolar disorder. So here we can see people with bipolar disorder show significantly reduced microbial diversity. So we see these decreased fecal bacterium. So this helps with anti-inflammatory properties, and this affects the severity of the depression the individual faces. Next, we see depressed ruminococci. So we see this causes increased intestinal inflammation or that can lead to leaky gut. This causes lower cognitive scores and brain fog. We also see decreased corpus. So this manages systemic inflammation and influences mood. We also see increased erythema. So this deals with gastrointestinal inflammation. So this triggers the immune system to release inflammatory proteins, disrupting neurotransmitter production and causes neuroinflammation that leads to mood instability and cognitive symptoms we see in bipolar. Increased lactobacillicase is linked to antipsychotic use in medicated patients. So this may be a factor in sleep disturbances and inflammation. So another thing we see down here is that there is differences in between the gut microbiota between bipolar disorder 1 and bipolar disorder 2. So on top, I listed what we see increased in bipolar disorder 1, and then at the bottom, what we see increased in bipolar disorder 2. So it's interesting to see that there's also a change between bipolar disorder 1 and 2. So this is a graph on the main findings on gut microbiota in bipolar disorders. So we went over some of the microbiota that we see, whether increased or decreased. So some of the things listed on here, gut microbiota composition can vary depending on the type of bipolar disorder. We listed the differences between bipolar 1 and bipolar 2. So another thing that's interesting to note here is that there's specific differences according to phases of bipolar disorder. So we have those depressive episodes, we can have manic episodes. So we see here that in bipolar depression, there's decreased bacterial diversity and higher IgA responses. And another thing that is interesting to note is that there's not much research done on manic or hypomanic phases during there's not much research done on these phases of bipolar yet, so we still have a lot to learn about them, what symptoms they cause, and possibly how we can counteract those symptoms. So next slide. So our next slide here shows exactly how bipolar physically affects the body, how the microbiota changes affect the body, leading to the symptoms that we see in bipolar. So leaky gut is caused by dysbiosis, which is the disruption of microbiota in the body. So this causes toxins to slip into the bloodstream. So then the immune system reacts to these toxins, and it triggers intestinal and systemic inflammation that we see here. And then, so mental and emotional stress is activated and the body is filled with cortisol. Then we have reactive oxygen species, ROS, produced when that dopamine is broken down, that dopamine that we see in mania. So the blood-brain barrier is weakened and inflammation leaks into the brain. So then we see microglia and astrocytes fighting off that perceived threat and damage. Oligodendrocytes are cells that create that insulating sheath, which we see that allows electrical signals to travel rapidly along the nerve fibers. So the microglia and astrocytes damage these oligodendrocytes, and then the damage to them causes those electrical signals to flow because we're messing with that myelin sheath, and then those signals can possibly get lost. This leads to some of the symptoms that we see in people with bipolar disorder, like emotional instability, we see down here, cognitive impairment, working memory, verbal learning problems, and negative emotion reactivity. So, future developments and treatments. Studies show the relationship between the gut microbiota and bipolar diagnoses are currently limited. So we don't have a lot of information, a lot of research that has been done right now. In fact, the research that I did gather was not done only on bipolar diagnosis specifically, but a broad range of mental illnesses, including schizophrenia, um, depression, anxiety, so several other factors. It's not just bipolar. So we have yet to specifically look into bipolar and how it affects the gut microbiota. So it's important, let's see. So possible treatments that we have here. Electroconclusive therapy. So we have only preliminary results of this therapy that shows that it causes changes in gut microbiota, but it has not been researched specifically in patients with bipolar disorder. So this is a possible avenue to be investigated, and we still have a lot to learn here. So this type of therapy involves placing electrodes on the scalp that allow an electrical current to be sent to the brain. So this causes the patient to have a seizure that is about 1 minute long, and the seizures are believed to alter the brain chemistry and that they aid in brain cell growth. So some of the side effects of this procedure can include confusion, soreness, muscle aches. Next, we have dietary intervention. So diet is known as a way to shape the gut microbiota. So possibly changing diets can help diversify that microbiota in the gut in bipolar patients that have very little diversity. We also see probiotics. They have shown to have anxiolytic and antidepressant effects in healthy population and in patients with mental disorders. So it was shown in research to lessen the risk of rehospitalization in patients who were recently discharged from the hospital due to a mania episode. Next, we see lifestyle changes. So one type of lifestyle change is an active lifestyle change. So low exercise has been seen in a lot of patients bipolar disorder, with bipolar disorder. So possibly increasing exercise can help increase that beneficial bacteria in the gut and increase the microbial diversity. So exercise has been proven to increase health, depressive symptoms, and quality of life. So next page. So for my last slide, I have my peer-reviewed references. I have listed 3 of them, and at the bottom we can see the link for each one. And that concludes my presentation. Thank you.